yet crucial responsibilities is that of evaluation. So, as we embark on this symposium, let us introduce our esteemed judge panel for today. We welcome Dr. Anupama Reddy Ma'am, MD Pediatrics, Pioneer Panelist Mother Care and Human Till Bank Project, Secretary of Aya General Trust. Give a big round of applause. We welcome you, ma'am. We also like to welcome Dr. Durga Prasad Sir, Professor, Department of ENT, Government ENT Hospital. Thank you so much, sir, for coming. We would like to welcome Dr. Sunita Ma'am, Professor and HOD, Department of Obstetrics and Gynecology, SBH. Thank you so much for coming, ma'am. We'd also like to extend our heartfelt welcome to Dr. Abbas Ali Sir, Assistant Professor, Department of Orthopedics, Osmecon General Hospital. Thank you so much, judges, for joining us today. Your presence and valuable insights will surely make this event a very successful one. So, without further ado, let us begin this symposium with an open heart and an eager mind, ready to learn, collaborate, and ultimately make a profound difference in the world of medicine. In a woman's life, she carries an incredible inner strength, a guiding light throughout life's ups and downs. However, in the journey of childbirth, this strength can sometimes shatter, revealing a vulnerability that contrasts with her usual power.
So, ladies and gentlemen, let us invite Team S10 to unravel an untold tale where her body becomes a man, tracing the paths of courage, love, and unyielding pursuit of dignity.
Check.
Hello.
Hello. Check. In the journey of motherhood, each step, each moment leads an imprint on the sands of time. Let us all embark on an impactful journey, a journey which is beautiful and pure at times, but also dark and scarring at other times. Let us explore everything a woman goes through to bring in this world a young breath of life. Let us not cower away from the dire circumstances she faces. Let us also not shy away from the beautiful experiences she makes. Because she remembers all the powerful moments etched in her soul. The unwavering support that carried her through. The hurdles she leaped over, each one making her stronger and stronger. The euphoric and transformative moments that defined her and gave her purpose. But even after the unforgiving waves, like the remaining footprints of sand, some memories endure the wrath of time. Presenting to you, Maternal Imprints. Today, our team brings to you a qualitative study, body mapping, women's narrative of respect and disrespect during childbirth from the urban and rural settings of Hyderabad.
India has shown a significant reduction in maternal mortality rates from 130 deaths in 2016 to 97 deaths per 1 lakh live births in 2020 to the promotion of institutional deliveries. But is this truly an achievement to be proud of? Especially when it coincides with a concerning decline in the provision of respectful maternity care.
The statistics paint a heart-wrenching picture. A staggering 89.1% of women who endured disrespect, neglect, and abuses in childbirth remain tragically unaware of the profound injustice they face. They perceive these harrowing incidents as an inevitable sacrifice to attain the precious gift of childbirth. Therefore, it becomes all the more important to highlight the importance of respectful maternity care in a way that can resonate with the masses.
To achieve this, we use the simple yet innovative concept of body mapping to document will map out a journey of transformation and awareness, one that envisions a future where every mother in India receives the respect and care that she truly deserves during the arrival of her baby.
Our study delves into the good and the bad experiences of a woman's delivery, through which we can understand the countless factors that influence the dynamics of this whole journey. We aim to shed light on the abuse and neglect these women face and to investigate the underlying causes and to enlighten the women about what they can expect during the delivery by emphasizing more on respectful maternity care. We portray these accounts through body maps.
But what is a body map?
Body mapping is the process of creating life-size human body images using art to visually represent a person's embodied experience. It is a form of storytelling which enables the subject to communicate creatively. This allows our mothers to express their emotions which were difficult to verbalize and articulate intimate details of their story which would have been overlooked in a mere verbal engagement. Body maps are easy to interpret because art is the earliest form of communication known to man. We did an observational study on 8 women selected from the urban and the rural sectors of Hyderabad who delivered in the last 2 years. In our study, we interviewed these women through a 7-guided questionnaire that identified 7 categories of disrespect and abuse as mentioned in the Bowser and Hill landscape analysis.
Within a 3-hour time limit, we interviewed these women where we gave them the opportunity to freely express themselves while we simultaneously guided the artists in making the body maps. The woman was demonstrated to lie down on the chart by the interviewer so as to make her comfortable. We used discourse analysis to understand the social context behind the woman's testimony and her larger outlook on the experience.
The study we conducted engaged with 8 women, each exploring her unique story and her perspective on what she considered a good birthing experience and what as bad. Verbal and physical abuse emerged as the most common form of mistreatment, often tolerated by women who perceived it to be a part of the process. R01 shared an excruciatingly painful episode of episiotomy where she was not given any anesthesia. Not only this, at various centers, extortion of money was rampant. They demanded 2,000 rupees just for handing over the baby. A woman was even blindfolded during her delivery. This kind of treatment given to a mother sends shivers down my spine.
Denying admission to pregnant women in need or neglecting their respectful care just because they didn't have their antenatal card in that institution is indeed a grave violation to their rights. This case I am referring to is R05 who delivered her baby right on the wheelchair on which she was taken to the delivery room. She said, I quote, the baby was about to fall from the wheelchair and I almost caught it. Why? Because she was left alone for hours neglected in the labor room.
But it would be wrong to claim that disrespect is the only thing happening with mothers. Our study has highlighted innumerable instances of respectful care during childbirth. No matter the setting, sanitation, respectful handling, and adherence to COVID protocols gave women assurance of quality care.
A calming and reassuring touch could relieve at least some of the pain these women were going through during childbirth. On a positive note, majority of these women were devoid of any discrimination on social grounds and were addressed with their respective names and in their local language. Appropriate consent, privacy measures, and encouraging words were valued by these women. It made them feel like they were never alone. Effective communication were highly appreciated by these women. One of the women narrated an incident where she told that she did not like the male presence during her delivery. The male doctor immediately substituted himself for a female physician while also not allowing any other men to enter the delivery room. Instances like these may not seem like much, but create an enormous impact on the mentality of the women. They feel valued and they feel respected.
Respectful maternity care is the primary right to all women. It emphasizes the need for compassion, care and support as these women embark on the remarkable journey of bringing a new life in this world and nurturing the future. Body mapping during childbirth really brings out the incredible complexity and beauty of the human body by emphasizing on the psychological and emotional aspects.
Our study may be a torchbearer to develop modules and courses and encourage it to be inculcated in Indian medical curriculum. Developing modules and courses specifically focused on respectful maternity care enables collaboration between medical students and other healthcare disciplines like midwifery, nursing, social work to promote a holistic approach to maternity care, and also provide hands-on training, simulation scenarios that simulate real-life maternity care situations. Let us carry this understanding forward, well-being of mothers as we strive for a better and harmonious world.
A baby's first cry is the sweetest symphony, and maternity care is the orchestra of new life.
Birthing process is a tapestry woven with movements of vulnerability and strength.
One of you can answer my question. Which component do you think is very important in respectful maternity care?
According to us, privacy and confidentiality measures are most important because all the women that we interviewed had one complaint that they did not take consent, privacy and confidentiality. Like even the curtains were not properly put when they were examined per vagina, so they were not at all comfortable. They clearly mentioned this one thing very important.
So do you think all of this during the process of delivery?
Yes, ma'am. They said, we are just quoting what women said. Women said that at least the mother of the woman who is delivering or the husband should be allowed in the room while she is in labor pain. And they also mentioned various factors like the nurses, the midwives that were supposed to be with them were not there. One of them even delivered in the wheelchair because of lack of this concern. So they were particular about it.
Ma'am, I would like to add to my colleague. RMC guidelines given by WHO clearly states that the woman should be given the attender of her choice. So we believe that she should have some support during this vulnerable process of birth and giving a life to a newborn. So that is a basic human right, I feel.
Good luck, guys.
Thank you.
That was a real wonderful presentation, and it is the in thing that we need to respect, and you have presented it beautifully. So, questions to you while listening to all of this. What we were talking about was a birth companion. That is a term used by the WHO. It's called a birth companion. Are you aware of that? The role of a birth companion. Do you have any idea of the role of a birth companion?
Ma'am, a birth companion is a person who is supposed to be with the mother when she is in grave pain. First thing. Secondly, sometimes people become very anxious. Like the lady who is delivering for the first time is always anxious. Birth companion helps or supports that woman, calms her down, most importantly, as far as we know.
Yes. The next doubt I had is because you're interviewing these mothers 2 years after the delivery, right?
Within the span of 2 years. Ma'am.
Within the span of 2 years. So do you all have any questions to ask about her PTSD, postpartum depression, these kind of things? Did they give you as a part of this? Because this was like a turbulent flow for them. So PTSD, did they talk about?
Ma'am, we have used a semi-guided questionnaire to ask about the situations they were there, which was divided into 7 categories. which also elicited questions about their mental agony along with the physical agony. Though these women don't know what exactly PTS, like postpartum depression is, or what postpartum blues are, they were, from their answers, we could tell that they were in a spectrum of agony, mental agony that they were facing, though they couldn't exactly use the terms that we normally use. Thank you.
The last question is, do you think these things exist in private sector too?
Yes, ma'am. We have observed that in few of the private institutions, the ayahs are asking for money, and of course they're happy that they had a child, but still it might not be in their financial capability to give them money. So I don't think it's acceptable for them to ask for money. Thank you.
Thank you very much. Ma'am, could I also add another point to my colleague? That in one of the cases that we have interviewed, this woman has went to a private setting, but since she did not have the antenatal card from that institution, it was a private institution, she was denied admission until she was almost about to deliver the baby. So I think this kind of treatment is not acceptable regardless of the setting of the institution.
Ma'am, I would also like to add on a point. In many of these cases, we also observe the abuse and neglect that these women face is not purely intentional in many cases. A lot of times these abuses and neglects can be attributed to the lack of resources or the time that the healthcare professional can allocate to each woman. So we also wanted to highlight this point.
Outstanding presentation, and I was struggling to find where to cut marks, not award marks. That's the greatest tribute to this presentation I can give you.
Thank you so much, sir.
Yes, some of these problems, because I worked for very long in rural areas, for 5 years after my illness, where I conducted deliveries, we had some problems. Controlling the mob there, controlling the people there, allowing the privacy of the patient was near impossible for a single doctor, for a single nurse, against the mob. Each of them were thinking that they deserve to stay there, they deserve to support. Controlling them is a bit difficult in rural areas. Practically, it is a big problem. Yes, we face it. And the delivery rooms are the labor rooms that we had in those areas. They never had any windows. They were open. We had a lot of problems with them. These are practical problems, but nowadays the Telangana government has come ahead. They have come with improvement of health and medical facilities. Many of the women, more than 60% compared to yesteryears, they are now resorting, they are now coming to the government hospitals and undergoing deliveries. This is a tribute to the present Telangana government that we all must appreciate. And the compassion with which you presented this, it really brings tears to my eyes. It's beautiful, the way you cared for the mothers there and how they feel on that. Neither corporate sector nor the government sector is very tough. The problems that you are telling of the many places, unless you pay the amount, your child is not given. And there are many instances when the children were changed. The other child was given, that problem was there. All in all, it was very good. My only complaint is that given the number of patients we have in maternity hospital, you need not have resorted to some photos of Western patients. They should have been Indian patients. Why should we have those stock photos? Yes, they may be representative of some problems, but had you gone to veterinary hospital, you could have got all those photographs, and you don't need stock photos.
So we tried to take videos but not giving consent. That's why I tried to find videos on the net for Indian patients and maternity care related to Indian hospitals. But the amount of good quality videos present on the net are very less.
I hope this video goes on it and people can use this.
Not yet. It should be our work. You should have taken a cell phone to the maternity hospital. 1 out of 10 must have consented. So that is the only sole point of the entire presentation. But for that it is 100%.
Thank you, sir.
Excellent. Excellent.
Just one thing I would like to add, wonderful presentations of these body maps that you have made. I just want to understand the purpose of this, just the purpose and what we will do with these body maps once you are done with this Osmecon.
I was a representation where we have placed the woman's body and we have visually represented all the factors that play a role in the woman's birthing experience and how they dynamically impact her experience. One thing is, a lot of these women had trouble communicating with us, expressing their views. A lot of women felt shy or embarrassed to talk about their experience. So in our 3-hour session that we conducted, we did an interview followed by this body mapping session. And as the body map started to come through and come in place and form an image, the woman felt more open. She was able to form a rapport with the interviewers and the art person. She was able to really express details that she couldn't express verbally before. And body maps can also be used as a therapeutic tool, as the woman can reflect on her experience by looking at it and gain deeper insights. And we can also use this for further campaigning and raising awareness about maternity.
Sir, I would like to add just one point. Like, these body maps are actually visual representation. So kind of a linguistic barrier that exists between the interviewer and the woman who is expressing herself is broken when we put a map in front of her of her body or what experience she is going through. Because anyway, women were not comfortable expressing themselves against the delivery institution where they delivered. But when they saw a visual representation, they could actually map in their mind what all happened in that day. So that map actually helped us in this.
I would just like to add a small point, sir. Most of these women did not know what was the abuse that was happening to them. They thought that this was part of the process. They just want to take their baby and leave, but all these things is imprinted in their mind. So when we are mapping this body map, they recollect their moments and then actually understand that this was the form of mistreatment that happened to them, and they could educate their fellow women who would undergo this process in the future to be more aware and sensitized to the issue. Thank you so much, sir. Thank you, sir.
So sample size of 8 was also very difficult for us. But first of all, we had this special population that we are considering. Second was the consent barrier that we had. Women were not comfortable telling us. The third one was the gaining of trust of the women that we are interviewing. It was very difficult for them to even open up. So that was it.
Like to add a point. Actually, since this is a qualitative kind of study, our sample size, we have not, 8 is our saturation point. 8 is a point where we have calculated the sample size to be 14. But there was a point of repetition after 8 women. So we have limited our sample to 8 and we have taken detailed linguistic transcripts of these interviews. So 8 is not the limitation of our study, I would like to say. Thank you.
Who has worked in 3 super specialty hospitals, and my question was, I have seen a beautiful patient flow that has been worked through the minds and everything. So based on 8 patients that you have answered and interviewed, do you think that this scenario can be generalized? Because as much as I have worked in the hospital, the barriers for us was the huge patient load, but despite having that a huge patient load, I would say that ma'ams here and under the ma'am's guidance, we have opted for the best care that we could provide, be it for the privacy or the education and the dignity of basically. So yeah, and there are situations where the misinterpretation might take place. Like when we, for example, you might say, when the patient is asked, not to move, they won't listen to us. So that they might go into precipitate labor, but they won't listen to us. So I wouldn't say that doctors cross a boundary so as to abuse them, but I would say that, a doctor would give something like, a gentle nudge to them. So that might be misinterpreted as abuse by the patient who is already in the pain. So regarding that, how do you want to answer that?
Thank you for the question, sir. The entire story and the good and bad experience which I've said, it is from the patient's point of view. They don't find the patient's side or the healthcare provider's side are not biased. From her point of view, this is what she has explained, and these were the testimonies. And as you said, yes, the patient role is a lot, and the healthcare providers are trying their best to give the best possible care. But we should also consider the women's EQ level, which is very low during the traumatic stage, and it's a very painful process. So that's all.
So adding to it, I would like to say, first of all, we are not saying that this is good or this is bad. We are saying good, bad, and respectful. So we are mostly trying to bridge the gap between what women understand and what the healthcare givers are trying to give. That if the gap is bridged, then maybe the women who is having or getting the facilities, maybe valuing them more or understanding them more. Regarding this one small example, I'm sorry I'm taking time, but one small example, the RMC says that during the delivery, the healthcare professional should not touch the abdomen or any place on the lower part of the body, so that she feels stressed. But one of the women herself said that she felt very comfortable when it was touched. We cannot teach them, every coin has two perspectives. So what is good or what is bad, it's totally the women's part that they're trying to do.
I would like to add another point, and this is where the point of communication between the doctor and the patient is very important. Because the woman is with the doctors from their antenatal checkups in most cases. So from then on, bringing a rapport with the patient and educating the woman from her antenatal checkups itself is one thing that we can do in order to reduce this miscommunication and other mishaps that can happen. Another thing is the government of India has already launched many programs like Lakshya certification, where they give certifications and train healthcare professionals in the delivery room and give certifications so that they can follow the latest guidelines and protocols.
Just a small point to add, sir. We know that, especially in the public setup, there is a lot of patient load, and the abuse that we have mentioned, it goes unnoticed. But as medical students ourselves, if we are sensitized about this issue, we can act as the bridge between the doctor and the patient. And just small things like calling them with name and asking how are you can go a long way. And we are not telling that doctors are not doing this, but as